and welcome to Health Hope. We know that your health is important, so we have designed this program especially for you. Through interviews with health and wellness professionals and stories of those who have overcome difficult life experiences, we want to bring you the most up-to-date information and current trends on health and wellness. Thank you for joining us today. I'm Gail McKenzie, and I'm your host. We have with us as a special guest today, Dr. John Jordan. He's joined us today to talk about heart disease. Now, Dr. Jordan, you're from Madison, Tennessee, and I understand you're a family practice doctor. Is that right?
That's correct.
Okay, all right. Now, Dr. Jordan, you've been practicing for 35 years. You've seen a lot of patients. What is the most common disease that you treat in your practice?
Okay, I think probably heart disease is probably the most common one I see.
Okay.
It affects about 1 in 5 Americans.
Wow, that's a lot, isn't it?
That's a lot. Talk about 62 million Americans have heart disease right now.
Wow.
And every 30-some seconds, someone dies from heart disease.
Really?
So that's why it's really important.
I guess so. Can you define for our viewers what heart disease is?
Okay, anything that adversely affects the heart and the arteries around the heart.
Okay.
The arteries around the heart are called coronary arteries.
Okay.
And so we're going to mainly talk about the trouble with the arteries and why it's important to understand the prevention of building up the blockages in the arteries.
Okay. Can I ask you this? What is too much? You know, how is an artery blocked too much? I mean, are there degrees, or how do they measure that?
Okay, you get cholesterol buildup in the arteries, and it can happen anywhere. But when it's around the heart, if an artery gets blocked up enough, it can get blocked off entirely and cause death to that part of the heart muscle that artery supplies, and that's called a heart attack. And so most people, when they start getting the blockages, they don't have symptoms until maybe the artery isn't blocked to about 95%, which is a very, very tight blockage. But the trouble is they don't have too many symptoms before that.
Okay, and what would be some of the symptoms leading up to that at the 95%? How would we know that we were having a heart attack?
Okay,
sometimes for men specifically, maybe.
Okay.
Give them that treatment, or what would they have as symptoms?
Okay, the problem is sometimes there's no symptoms, but the typical symptom that a man would have would be chest pain with exertion. Okay. That's called angina.
Okay.
They can get shortness of breath, loss of energy. And if that starts happening, they need to see their family doc or their internal medicine doc. Okay.
And what can they do for that? Well, let's go back, actually. I'm going to back up. That's men. What about women? Are the symptoms the same? What would a woman do, or how would she know that she had blocked arteries?
Okay, they could have the same symptoms, but most of the time it's different. So that's why you have to be suspicious when a woman comes in with fatigue, shortness of breath, and you can't explain it any other way. Sometimes they even have trouble sleeping. Anxiety can be a part of all that. And so you just have to be real suspicious. And I use a very low level of suspicion to say, hey, we got to get this checked out.
Okay. Yeah, it wouldn't be anything that you'd want to mess around with, would it? I mean,
exactly.
Or to, wait for. What can they do in a hospital then if you're my physician, or if I have a heart attack? What are the procedures that they would perform on me?
Okay, the bad news first.
Oh dear, okay, there's bad news, all right.
About 40% of people who have heart attacks don't even make it to the hospital, they die.
Oh, really?
And so that's why we really need to pay attention to this.
Yes.
If you do make it to the hospital, the emergency room is geared up to get you in very fast. The cardiologist usually is called right away. They can put clot breaking up medicines into the arteries to try to break the clot up to save heart muscle. The cardiologist usually takes you to the cath lab where they put catheters into coronary arteries and try to find out where the blockages are. And then what he could do right away is put stents, which are little metal springs that that keep the artery open and keep the blood flowing. So sometimes they can put stents in. If they can't put stents in and the arteries are too blocked up, they have to go on to bypass surgery.
Okay. It's interesting. My father just recently had a heart attack. And luckily, he had a lot of pain right in his abdomen area, and he didn't know what it was. And he was taken to the hospital, and they put a stent in. And I saw the pictures of before and after, how the blood flow was just not getting through that artery, and then the stent. It's amazing what they can do. Can you describe for our viewers what the cath, what they would do? How does that work? What is a heart cath?
Okay, well, usually they go through the groin, which is a larger artery there.
Okay.
And so they thread a catheter up into the coronary arteries.
Okay.
And they put contrast material in there, and then they take the pictures. And so when they take the pictures, they can see where the blockages are. And if they're amenable, they can put the stent in at that time.
I see.
Or go on to bypass surgery.
So it's a little camera that they just go up with first, then to look at everything, or
not a camera. The camera's on the outside, taking pictures of the heart with contrast material going through the arteries.
Okay. Well, that's good to know. Let me ask you about the risk factors with heart disease. What are they? Well, of course we know heart attack, but what can cause that buildup in the arteries? What is it that we need to be aware of?
Okay, obviously prevention is what we're talking about.
Yes.
You know, we don't want to get to the point where you have a heart attack or the arteries are blocking up and that kind of stuff. And so there's several different risk factors.
Okay.
The first one we can talk about is family history. You got to choose your parents right. Unfortunately, you don't have too much choice there.
No, we don't, do we?
But family history does play a part.
Okay.
Since your father had heart disease, you have to be more conscious of your own health.
Okay.
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 Then we can go on to other cholesterol is a risk factor. High cholesterol, hypertension, diabetes, sedentary lifestyle.
Wow, there's a lot.
There's a few.
Yeah.
There's a few.
So what about high cholesterol? What is considered high? I mean, you take a little cholesterol test, and how do you take that? How would I have my cholesterol tested? Do I go into the doctor's office? Can they do that?
Yes, it's a simple blood test. We like to see the cholesterol around 200 or below. Below is even better.
Okay.
If you don't have heart disease, 200 is good. If you do have heart disease, you know, the cardiologist and the family docs and everybody else wants your cholesterol a lot lower than that. But it's a simple test to do. Some screening areas, some at the mall and different places, they can even do a finger stick and check your cholesterol.
Really?
So it's a good idea to know your cholesterol number.
To just keep track of that, then. It's a good thing to know.
One more thing. High cholesterol is above 240. The in-between borderline is 200 to 240. Those are kind of the cutoffs.
Okay.
But it also depends on the rest of your health as far as what we're going to do. We may get more aggressive with some people at a 230 or 220, depending on what the rest of their health is.
So you just do a whole battery of tests probably just to kind of define where a person's at and get there.
Right, we can look at we can look at the good cholesterol. We can look at the bad cholesterol. The higher the bad cholesterol,
good and bad, huh?
Yeah, there is good news.
Okay.
In fact, I even saw a lady today. Her good cholesterol was the highest I've ever seen it. It was 97.
Whoa.
Usually, it's in the 20s and 30s and 40s.
Okay.
It's best right around, about 40. But the higher it is, the better. And she had a cholesterol of 300. But with a good cholesterol of 97, it kind of negated the high cholesterol. So we're looking at that, so I had to calculate to see if she really needed to be on medication or not.
I see.
So what we try to do is get the bad cholesterol, that's the LDL, the low density lipoprotein cholesterol, down. We like that closer to 100. And that's done with a profile, a cholesterol profile.
Okay.
So we look at the good cholesterol, the bad cholesterol, and the total cholesterol.
Okay. Now, what about high blood pressure? Because you mentioned that. How does that contribute, and how do you treat that then? If I were to have, and where's the line that I would have high blood pressure?
Okay, high blood pressure is a very common problem also.
Yes.
It may affect almost half of adults above 50, but
really?
I've seen those numbers somewhere, but don't hold me to it.
That's
but
pretty high.
It's very common. It's
yes.
very common in my practice.
Yes.
So anything above 140 systolic, over 90 diastolic is what we consider hypertension.
Okay.
And if it's there, we want to treat it. Lifestyle changes can help. Exercise can help bring it down.
Okay.
Salt restriction can bring it down.
It's always salt, isn't it?
Always salt, yeah.
Salt, okay.
So watch your salt intake, and a good healthy diet can help lower the blood pressure. But most of the time with hypertension, most of the time people do end up on medication.
Okay. Just to keep that at a good level, right?
Right.
Now let me ask you, you mentioned sleep, that's important. I know that people, you see advertised a lot, sleeping pills, if you have trouble sleeping and whatever. When you talk about sleep, how can I get a good night's rest? What are some things that I can do to ensure that I'm going to sleep well? Got any tips for us on that?
Oh yeah.
Okay, all right.
Try to stay away from sleeping pills. That's
okay.
That's
Tip number one, then, right? Yes. Okay.
It's not the best way to treat it. Obviously, sometimes we have to go that route. But a few things to get a good night's sleep.
All right.
Exercise during the day, not right before sleep, but exercise during the day. It's a very natural way to help your body kind of relax later and help you go to sleep. Don't eat a big meal before you go to bed. A glass of milk is okay, but not a big meal. Stay away from caffeine. Some people drink their coffee in the morning, some people drink it in the evening. I have some people that drink it and go to bed. I don't know how they get to sleep, but some do. But again, stay away from stimulants, which is the caffeine, and any caffeinated beverage too. Your Cokes, Pepsis, and all that kind of stuff. And get your time that you go to bed about the same time. Our body does have a rhythm.
Okay.
So you go to bed about the same time every night, and you get up about the same time every day. And so when your body gets used to that, those kind of things do help you get a better night's sleep. Yes.
To continue that. Well, that's good. That's good to know. Now, you mentioned also diet. How does diet contribute to heart attacks, and how can I change my diet? What are some ideas that you have for our viewers so that they can maybe go back to the grocery store and buy things that are going to help them be healthy? What would you suggest? Okay,
a couple of risk factors that I really didn't mention was obesity and diabetes.
Oh,
that really ties in diet.
Oh, yes, I guess so. Okay.
So if obesity is a problem, and it is a problem because it adds multiple risk factors to all sorts of different illnesses.
Okay.
What I recommend my patients who are obese, first of all, give up your sweet drinks, your Cokes, your Pepsis, your sweet tea.
You've probably hit a lot of people there.
Don't be mad at me, but there's a lot of empty calories there.
Okay.
And I get some people come in, they're drinking 3 or 4 Cokes a day, and I add up the calories that they're getting. A simple rule that I kind of go by is that if you drink, or if you get 500 less calories a day, that's a pound a week. Either you can lose it, or if you're going to drink that much or eat that much more, you're going to gain it. So 500 calories a day.
Okay.
If you reduce it either by reducing your intake or exercising.
Okay.
Okay. So those are some simples.
That's a good gauge. So if I just take away 500 calories, I will maybe lose that pound then or 2 that you need to.
Yeah.
Right. So that's a really good tip, Dr. Jordan. Now, you've talked about diabetes, and what about diabetes? How is that something that can contribute to heart disease? What happens there for a diabetic? What do they have to watch out for?
Diabetes is a disease of the small blood vessels. Most people don't die of diabetes; they die of the consequences. And heart disease is one of the biggest consequences of diabetes. So basically, what we try to do is get the diabetes under control. Either with everything, diet, exercise, medications, if you have to go on insulin, that kind of stuff. And it's a complicated issue. It's a total change in lifestyle. And that's why a lot of people have trouble with it, because it involves their whole life. So eating less, losing weight. I tell my diabetics, if they just lose 5 to 10% of their body weight, their diabetes is much easier to control.
I see.
And it is.
So that is a major factor then for them to watch for and to keep control of, I'm assuming. That's good to know. Now, what about smoking? How does that contribute to heart attacks, or does it have an adverse effect on your heart?
Okay, well, we got to mention smoking.
Yes, yes.
I'm not sure if we mentioned it before, but anyway.
I don't think so.
I think I missed it, but smoking is probably the most, what should we say, it should be at the top of the list of causing heart disease and all sorts of other things. So I have people come in, they're trying to watch their diet and all that, and they're smoking. I say, well, you know, let's talk about diet, but let's talk about your biggest risk factor is the smoking. Okay, I saw a guy today. He's smoking 2 packs of cigarettes a day, and he's going to try to quit. He tells me, and I hope he will.
Wow.
So let me give you maybe some pointers on how to quit.
Okay.
You know, right now we have a lot of smokers out there. In fact, Tennessee, it's about 30% of the population smokes, which is unfortunate. Nationwide, it's maybe like 20–25%. But anyway, everybody has probably tried to quit smoking one way or the other. And what I tell them is that whatever way you can do it, do it. Okay. There's Chantix, which is a new medication that helps people quit. It's about a 50% success rate. So talk to your doctor about that. It's a prescription medication. There's patches, there's gums, there's little things you can put in your mouth and inhale some nicotine so you can get rid of some of the tars and all that, and eventually quit. But sometimes when the patient comes in and they've tried many different things, I say, well, let's not give you an expensive medication. Let's just talk about cutting back, okay? So what I talk about is counting cigarettes. If they're a pack-a-day smoker, I tell them, tomorrow morning, take out 2 cigarettes and just smoke 18.
Okay,
and then after you get used to that, smoke 16. And go down, and after 10, I tell them to go down by one at a time. Okay. And they can take, you know, weeks to do it. They can take a few months to do it. I just want them to do it. If they want to go cold turkey, you know, that's fine too. But a lot of people can't go cold turkey. Yeah,
that's very difficult for some. Yeah, I have had relatives who have done it cold turkey, and then I had a brother-in-law who it took him several years. He would quit, and then it just was a very hard addiction to overcome sometimes. Now, you mentioned exercise, which is something we hear a lot about also. And we live very sedentary lifestyles, I believe, more than we did in years past. What can we do? How can we get that? What do we need to do? And give us some suggestions for that. How's that?
Okay. Basic, when I have a patient who comes in and they're just not exercising, they come home from work and they just plop down and they're a couch potato, right?
Right.
Sometimes I just encourage them to get out and do something for 5 minutes. You know, I mean, anybody can do it for 5 minutes. You know, don't have enough time. Well, 5 minutes. That gets them into thinking about some kind of exercise. Even on their exercise machine at home, if they have one, I say just do it for 5 minutes to start out with. Once you start doing it, then you're going to say, well, I can do more in 5 minutes. You know, let me go for 10 minutes and 15 minutes. What the recommendation is to keep active is about 30 minutes a day, and you can break that up in 3 10-minute segments, is what they tell us.
Okay.
And so if you can't do it one day, try to work it in 4 or 5 days a week. But exercise is one of the best things we can do to help our heart health, to help our sleeping, to help our overall well-being. It just helps the brain function better, and people feel so much better when they start exercising.
Right. But do we have to do a marathon? I guess that'd be my question. just 10 minutes a day, like you said, or here and there. We don't maybe have to do that much exercise, right?
Yeah, and one other thing is that even gardening, doing stuff around the house, being active, that kind of stuff counts.
Right. Just even to move around, just get up and move, right?
Work out in your garden.
Just keep going.
Get off the couch and start moving. That's the idea.
It's the couch potato thing, right?
The couch
Is that
potato.
what we're talking about? Right. Okay. Well, Dr. Jordan, you've given us a lot of information here and some really good thoughts and things that we may all need to change in our lifestyle. But let's go back to cholesterol and talk about that a little bit. In my diet, what do I look for that are high cholesterol foods? What are some things that I may need to cut out of my diet or actually, you know, maybe just not eat as much of? What can you share with us for that?
Okay, cholesterol comes from meat and meat byproducts.
Okay.
Okay, so if you get away from the red meats, that's one of the worst ones to eat. Go toward the leaner meats. If you want to become a vegetarian, that's fine, but go toward the leaner meats, the fish and the chicken, that kind of stuff. Get rid of the skin of the chicken. It has a lot of fatty acids on it.
Oh, really?
So get rid of the you know, if you're eating meat portions, cut out the fat. You know, cut out the fat. Okay. Go toward the leaner meats. The leaner hamburgers and those kind of things. Right. And then look at the rest of the meat byproducts. You know, you're talking about milk. Go toward skim milk, 0.5%, 1%, but get away from whole milk, get away from 2%, and try to get down to skim milk. Go for the low-fat yogurts. Eggs, everybody likes eggs. Keep it to a minimum. You know, try to keep it down to 2 or 3 a week rather than one every day.
Yeah, right.
A lot of people come in, they eat their bacon and eggs for breakfast, and I kind of cringe and say, oh, cholesterol is going to be a problem there. So going more toward just the low-fat type foods. Fruits, vegetables. I tell my patients every single day, get more fruits and vegetables. Get away from the meat and potatoes and get out there and exercise, and you're going to feel better.
Ooh, but they're so good, aren't they? So you just really have to train yourself, don't you, to make those changes. It's not always easy, but it's better for our heart, right? Are there any thoughts that you can share with our viewers that you would like to leave them with, again, on heart disease, some of those things that they can do? Maybe give them those tips again so that they can take those to heart. How's that?
Okay. We're not only talking about heart disease, we're talking about strokes and many other illnesses. We're talking about a healthy lifestyle. Talk about getting exercise, so you get those muscles moving. That helps diabetics lower their blood sugars. Eating a healthy diet with fruits and vegetables. Keep sugar drinks to a minimum. Even with your kids, just get them away from sugar drinks. So exercise, eating right, and keep a positive attitude too. We haven't even talked about a positive attitude. It just helps you live better altogether.
It kind of works on your whole person, doesn't it? Too?
Sure does.
Yeah, that's really good. Thank you very much. Well, Dr. Jordan, I want to thank you for being with us today. This has been very informative, and I hope our viewers will have listened carefully and will take what you've said to heart. So, again, we want to thank you for being with us here today. I hope you've enjoyed it, and remember to watch us again, where health is the goal and hope is the anchor. In the past, most people lived in the country, had a garden, and worked hard physically. But now most people live in the cities, have cars or ride buses, and work at jobs that require little or no exercise. When people come home, many use their free time sitting in front of the TV or home computer. The scriptures tell us that in the beginning, our Creator made us a beautiful garden home and taught us that physical work was for our benefit. He designed the human body for active exercise. In Genesis 2:15, we read, "The Lord God took the man and put him in the Garden of Eden to work it and take care of it." Activity is the law of life. A man who would lie down and refuse to exercise his limbs would in a short time lose all power to use them. It's a law of nature that every faculty left unused grows weaker and wastes away. Yet, we find that today, men, women, and even children are getting less and less exercise. What happens when we don't get enough physical exercise? A sedentary lifestyle has been shown to significantly decrease our quality of life, while at the same time greatly increasing our likelihood of suffering from today's degenerative diseases. For example, inactivity is associated with an increased risk of heart disease, diabetes, osteoporosis, cancer, anxiety, and depression. Research has shown that individuals who lack regular exercise experience a similar risk of disease as those who smoke or have extremely high cholesterol levels. Here's what exercise can do for you. It can lower high blood pressure, protecting the heart and blood vessels, improve circulation, and promote clearer minds, better sleep, and faster recovery from sickness or injury. Exercise lowers cholesterol levels, decreasing the risk of heart attacks and strokes. Exercise lowers the heart rate at rest. And look at what exercise can do for your mind. It can greatly improve your sense of well-being. It makes you feel good. It increases your energy efficiency and endurance and won't let you down later. Outdoor exercise is even one of the most valuable weapons known to fight off depression. Exercise enhances our ability to handle life stresses. It improves your quality of sleep. It improves appetite control. It strengthens our body's natural defense, the immune system, to keep us well. It can even lower insulin requirements and help to stabilize blood sugar levels. Exercise strengthens bones by helping retain and deposit calcium and other minerals. To experience all these benefits, specialists recommend that we do this. Engage in some form of physical exercise 30 minutes nearly every day. Look for opportunities to exercise, walk to work or school when possible. Choose the stairs rather than the elevator. Take up active gardening, swimming, biking. And last, share your exercise with a friend. It's more fun. God made us to benefit from exercise. Let's follow God's plan and be sure to incorporate some form of regular exercise in our life every day. Thanks for listening today. This has been a Health Moment.